The following video will teach you how to use the 3M Tube Securement Device. Select the correct size device. For reference, the small 3M Tube Securement Device fits tubes 6 to 12 French. The large 3M Tube Securement Device fits tubes 12 to 24 French. If you're unsure which device size you need, it is best to size up. The following application steps will guide you to apply the device correctly. If you don't follow these steps exactly and find a way that is more comfortable to you, that is okay. Begin by prepping the skin and tubing thoroughly with alcohol wipes. Then, open the package and remove the device from its liner. Ensure skin and tubing are clean, free of residue, and completely dry prior to device placement for optimal adhesion. Just ensure you fully wrap the device around the tubing and have it lifted off the skin upon completion. To begin, align the body of the butterfly to the tubing. Wrap both wings around the tubing until they fully connect underneath and attach both wings to the skin. Apply pressure on the device and the tubing to maximize adhesion. Note: if you find the small device does not fully wrap around the tube, start over with the large tube securement device. If the tube is strapped and not fully lifted off of the skin, you have applied it incorrectly. When it's time to remove or replace the securement device, stabilize the tube and carefully peel back one corner of the device. Remove the first wing by peeling low and slow and parallel to the skin. While continuing to stabilize the tube, remove the portion of the securement device wrapped around the tubing, and then remove the remaining wing off of the skin, continuing to use the low and slow peel method. Learn more about the benefits of using the 3M Tube Securement Device, including the reduced risk of MARSI and pressure injury versus other devices or medical tapes, at 3m.com/tubesecurement.